the director of the Healthy Brain Clinic in Long Beach and has hundreds, I'm sure hundreds, if not thousands of patients, and they conduct trials, and the information that he has is probably even better than what I heard, because some more time has passed and they're working all the time to find help for people with Alzheimer's. But anyway, you will be glad you came. Dr. Trin is, not only is he a doctor, but he's a follower of Jesus, and he just is full of knowledge and help. So thank you for being here, Dr. Trin.
Thank you.
Looking forward to your message.
I'll second that.
All right. Can you guys hear me okay?
Yes.
Is this good?
Great.
Oh, good. Thanks for the invite. I heard there's another event going on right now on missions, right? And yeah, but I'm a medical missionary. I took a team to Vietnam this past July. I've been a medical missionary for a very long time. We have our own nonprofit I started a number of years ago, where we take doctors, nurses, high school students, college students to different parts of the third world to provide just free medical care and just to show God's love in action. And so I can totally relate to the other meeting with that. We're every year we're in Vietnam. We've been to Haiti about 10 times. We've been to Peru this November, Oaxaca, Mexico. Last year I sent a team to Kenya, and next year I'll be in Nigeria. Just medical missions work with that has been a calling to go out and just to serve the least of these in our society. In Vietnam in July, we did over 100 eye surgeries for the blind, and we worked at a leprosy colony. Can you believe there's leprosy?
No.
Yeah, over 300 patients with leprosy at a colony in Vietnam. So leprosy still exists today. We were there, although these patients were no longer contagious, they were given medications to treat them. The damage has been done. They've lost their hands, they've lost their feet, their faces deformed. And in Vietnam, if the damage is done, even though you're no longer contagious, the government still puts you in the leprosy colony. You stay there till you die. You're not allowed to leave. So we take our team there, and although we can't cure them, the damage is done. We make sure that every patient gets a hug. Because if you remember the Bible times, right? They're the untouchables. Nobody wants to touch a leper because of that fear of contagiousness. So we go there, and every patient gets a hug, and we let them know that although society have forgotten them, that God has not forgotten them, and that God has not forgotten their name. God knows who they are, and that they have value, whether they have hands and feet or not. They're valued. And so we do that. We do a lot of orphanage work. Lots of kids. We've dug some water wells, and we've built some schools in the past. So I have a big passion for missions work. It's a calling. I was just telling Pastor Ron, he was asking, why do you do this, Dr. Trin? Go around, just give talks and stuff like that on a Saturday, right? I was telling him, during medical school in New York, I was also involved with the church, leading the youth group and doing Bible studies and things of that sort. So during medical school, I was also in school at Calvary Chapel Bible College out in Murrieta. And back then, they had these corresponding courses where they would send you the material and the books to read. You got to answer the questions and write the essays and turn it back in with that. And between my second and third year, I felt like I had to make a choice because I was really pulled toward ministry at that time, being involved with the church and things of that sort. And I was in the middle of the book of Romans and with reading the gospel according to grace, where Pastor Chuck wrote, right? And was in the middle of that class, and there was this pull in the summer of second and third year of medical school should I finish Bible college and quit medical school? Or should I finish medical school, right, with that? And then the realization just hit me, I owe $80,000 in school loans. Maybe I'll finish medical school to pay it off. Wasn't sure if, ministry would pay off $80,000 in school loans. And so I finished medical school. But the funny thing is, God has a sense of humor. Because, in the last, 4 or 5 weeks, I've spoken at 5 different churches. And so I'm still in the pulpit speaking. It's just, I'm too sinful for the pastor position, so maybe I'll talk about health. And so this is kind of my ministry, to talk about how you can protect, the temple, right? The temple, your temple, the temple of the Spirit, with that. And so God's kind of pulled me toward going to churches and rather than preaching the gospel, I talk about health. And last week I was at Capel Beach Church in Dana Point. That's where Chuck Jr. used to be, and spoke there. I speak there every 3 months to their 60-plus group, and we always have different topics. It's not always Alzheimer's. So we talked about longevity, how to live to 100 years old. We talked about cancer. We talked about mental health. We rotate every few months for topics. And the week before that was at a Lutheran church. Next week I'm at St. James Anglican Church. And so it's very interesting. I never graduated medical school with the idea of speaking in churches, but churches have just been contacting me to talk about health, to kind of have that complete experience, I guess, the full experience of spirituality and physical care and all that. So how many guys know someone who have been affected with dementia or Alzheimer's disease? Almost every hand. I don't know if you realize, but in Orange County, Alzheimer's is the number 3 cause of death. Number 3 cause of death. What is the number 1 cause of death?
Gunshot wounds, probably.
Gunshot wounds? Wow. Heart attacks. Yeah, heart attacks, number 1. What is the number 2 cause of death? Cancer. Cancer is number 2. And number 3 is, believe it or not, Alzheimer's disease in Orange County. In Los Angeles County, Alzheimer's is the number 2 cause of death, right behind heart attacks. In England, Alzheimer's is the number 1 cause of death. This is a silent epidemic that nobody wants to talk about. Isn't that crazy? It's a silent epidemic with that. And the reason it's an epidemic is this, and I'll tell you several reasons why it's such an epidemic. First of all, nobody is looking for this disease until it's too late. Nobody's looking for it until your brain cells are like gone, when the symptoms are severe. Because when your symptoms of Alzheimer's is really just mild, right? Forgetting a word, a name, walking into a room, why am I here? Okay. When they're only mild symptoms, what do we blame it on? We blame it on getting older, right? And while we do that, we're losing brain cells. This is what happens in Alzheimer's. We're losing brain cells. As a matter of fact, our brain shrinks and gets smaller over the years with Alzheimer's disease. We know that because when we do brain scans of folks with Alzheimer's or dementia, the size of the brain starts to get smaller and smaller and smaller. And the reason for that is brain cells are going away. Make sense so far? Yeah? How many of you guys have heard about the Alzheimer's plaque? Anyone heard about it? Okay. Yeah. Anyone know the name of this plaque? Amyloid plaque, yeah. Tau tangles, right? There's 2 proteins associated with this, the amyloid and the tau. And what it is that these are proteins that builds up in the brain that are associated with Alzheimer's disease. Every patient with Alzheimer's have the plaque in their brain. 100%. Every patient with Alzheimer's have this plaque in their brain. 100%. If you don't have this plaque in your brain, you don't have Alzheimer's. 100%. If the plaque's not there, it's not Alzheimer's. Does that make sense so far? Yeah? And in a healthy brain, we each have 100 billion brain cells. Okay, in a healthy brain, we have about 100 billion brain cells. And in a healthy brain, our brain cells, they're always talking to one another. They're always connecting. They're always communicating. The brain cells are talking, connecting, communicating. Every thought that you have is simply a pattern of brain cells talking. Every thought that you have is simply brain cells communicating. Does that make sense so far?
Yes.
Every feeling that you have is a pattern of brain cells communicating. Right? Every thought, every feeling is just brain cells talking to one another. Every memory that you have is a pattern of brain cells communicating. So my memory of dinner last night could be this group of brain cells over here talking, okay? My memory of breakfast this morning, didn't have breakfast, but if I had breakfast, my memory of breakfast this morning could be this group of brain cells over here talking. Every memory is a group of brain cells talking to each other. Make sense so far? So what happens is this. The Alzheimer's plaque, which is a bad protein that shouldn't be there, what it does is that the plaque gets in the way as it builds up in the brain. It gets in the way between two brain cells trying to communicate. The plaque gets in the way between two brain cells trying to talk to each other. And in the beginning, when there's only a little bit of plaque, no big deal. The brain cells can get around that, right? So your symptoms are only mild. But as the plaque accumulates in the brain and there's more plaque, the brain cells can no longer talk to one another. It can't communicate. And when brain cells can't talk to each other, what do we call that?
Memory loss.
We call it memory loss. Because your brain cells can no longer communicate with each other. Make sense so far, guys? Yeah? I'm just taking the science and bringing it down to you, right? With that.
Question?
Yes?
So, it's just amyloid plaque that causes memory loss, or are there other causes of memory
Great
without
question.
amyloid plaque?
Great question. So the question is this: can you have memory loss without amyloid plaque? The answer is yes. Memory loss is a big umbrella called dementia. Make sense? What is the difference between dementia and Alzheimer's? So dementia is this big umbrella of every condition that causes memory loss. Under this big umbrella of dementia, Alzheimer's take up 2/3 of the umbrella. 2 out of 3 patients with dementia have Alzheimer's dementia, but the other 1/3, the other 1 out of 3 patients with dementia have dementia and memory loss for other reasons. So those patients don't necessarily have plaque. Let me give you some examples. Parkinson's dementia, right? That's another form of dementia. Lewy body dementia, frontotemporal lobe dementia, which is what Bruce Willis has, right? Dementia from having a deficiency of vitamin B12, dementia from hypothyroidism, right? So there are other reasons for memory loss and dementia, but those other reasons take up 1/3 of the umbrella. The other 2/3 of the dementia umbrella is Alzheimer's dementia, where the plaque is involved. Make sense so far? Yes.
So what about the memory loss that probably most of us have that isn't classified as dementia? Where does that
what about memory loss that most of us have that isn't classified as dementia? You mean like getting a little bit older type memory loss?
Right, like,
Yes.
wait, why did I forget the thing I just had on my mind to add to my to-do list 20 seconds ago? Memory
Right,
loss.
right. So,
Come on, people, we all
so
have
the,
it, right?
so the question is this, what is normal memory loss and abnormal memory loss, right? So that's the question, what is normal memory loss and abnormal memory loss? What is the, what do you call it, senile moment memory loss versus the Alzheimer's memory loss? So let me explain that to you, and you'll get a better idea with that. I'm just gonna pull this back a little bit, that way I'll walk around. So your brain stores memory like a computer stores memory in a hard drive, okay? Do you guys remember when you're working on computers and you're doing something, and if you want to save that program, you click the button save, and that file gets stored in the hard drive. Make sense so far? So your brain stores memory like a computer stores memory in a hard drive. So the first memory when you're young is stored first over here. The next memory after that, as you get a little bit older, is stored right next to that. And then the next memory is stored right next to that. So the memory is stored in chronological order, where the oldest memory is over here and the newest memory is over here. Like one long file. Make sense so far? Yeah? So childhood, grade school, junior high, high school, college, getting married, having a child, right? Grandchild, all the way to what you ate for breakfast this morning. One long file. In Alzheimer's disease, the Alzheimer's plaque, this amyloid plaque that builds up, and you have the tau tangles and all that, the plaque starts eating up brain cells in one direction, starting here with the newest memory first. Because in dementia, what do you lose first? Short-term memory or long-term memory? Short-term memory, right? So the short-term memory of what you had for breakfast goes first. You'll remember everything when you're young. You'll remember everything when you're young, but the conversation you just had 5 minutes ago, that's gone. Which is why patients with dementia or Alzheimer's, they keep asking the same questions over and over all the time. Anyone ever witnessed that? The reason is the short-term memory gets eaten up first, okay, with the amyloid plaque. So that's the start of it, is short-term memory loss. And then as the disease progresses, it starts going backward. So initially you'll forget that conversation 5 minutes ago. And then you'll forget what happened yesterday. And then you forget what happened last week, last month, last year. The disease progresses backward with memory loss. And that happens over time, because as time passes, it gets worse over time. Making sense so far, right? And what happened is that these files are going away, right? Your memory files are just gone, right? The conversation 5 minutes ago, what you had for breakfast, what you had for dinner last night, what you did last week. And then at some point, the file of a funeral disappears. If the file of a funeral disappears, that person is still what to the patient? Still alive.
Yeah.
Have you ever witnessed dementia patients, Alzheimer's patients, talk about dead people as if they're still alive? It's not because they're crazy. It's not because they're not making sense. It's because they're missing a file of a funeral that's eaten up by the plaque. Does that make sense now? That makes sense now. So when you witness folks with dementia talk about stuff that doesn't make sense, they talk about dead people as if they're still alive. It's not because they're crazy. It's not because, they're dumb. It's because they're missing files in their brain, eaten up by the plaque. So there's no point to confront them. There's no point to argue with them because it just creates more frustration, right? You just have to realize that a patient with dementia, a family member or a loved one with dementia, do not have the same reality you do because they don't have all the files that you do up here. So their reality is based on what files are there. Make sense so far? So that's the difference between normal memory loss and abnormal memory loss. Normal memory loss is forgetting things, but it's intermittent. Like you forget something today and then you're fine for a few days, and you forget something else and you're fine for a few days. It's not predictable, it's intermittent. The memory loss of Alzheimer's first starts with short term, it goes backward, and it gets worse over time. So that your memory today is worse than it is 6 months ago. And 6 months ago was worse than a year ago. It's progressively worse because the memory files are being lost backward. Versus normal memory loss, right? It's intermittent, it's not predictable, and it's not worsening over time. Does that answer your question? That's the difference, okay? That's the difference. So my question to you is this. How do you know if you have plaque in your brain? Autopsy, okay. Yeah?
Not a very good answer.
Okay. If you were to ask me that question 10 to 15 years ago, that was my answer. Autopsy. And back then, we couldn't do a prevention program, right? We're talking about prevention today, because it was after the fact. We had to wait till the patient died to confirm the diagnosis, an autopsy, right? But in the last 10 years or so, I'm in the field of research, by the way. This is what I do. I do medical research, clinical trials and all that, right? That's the work I do. In the last 10 years ago, we now have a brain scan that will find the Alzheimer's plaque. Does anyone know the name of the brain scan?
PET scan?
It is a PET scan. Anyone heard of PET scans?
Yeah.
PET scans are normally done for cancer evaluation and staging, but we now have a specialized PET scan that will look for the Alzheimer's plaque. So there's good news and bad news behind that. The good news is that the scan is available, FDA approved. The bad news is most insurance don't pay for it. Most insurance don't pay for it. That's the bad news, right? The technology is available, but you can't just walk up to your doctor and says, "Doctor, please send me for a PET scan to look for Alzheimer's." They're like, "What?"
Once a year.
Right? Once a year based on your symptoms. You gotta have very specific symptoms, right? And the other thing is PET scans are not available across the country. Right? They're available for cancer, but for Alzheimer's, there's a special medication that's given through the IV that goes up and finds, that tags to the amyloid plaque. That's not easily available throughout the country. Right? So in the last 10 years, we now have PET scans. Now the other way you can look for the plaque is through a procedure called a lumbar puncture. They stick a needle in your spine, pull out some fluid, and they look for the plaque in that fluid. Not a very popular test, is that? It's like an epidural, right, when you're pregnant. So that's another procedure, but hardly anyone gets that, including patients with Alzheimer's. They don't get it either. Nobody wants a needle in their spine. Now, in the last 2-3 years, and this is what we do at our office. I'm in Long Beach, and we do clinical trials, and we do it at no cost for participants. In the last 2-3 years, we now have a blood test. We now have a blood test to detect the Alzheimer's plaque. It's about 90% accurate, correlating with what's in the brain. Good news, bad news. Good news is that the technology is available, the blood test is available. What's the bad news, guys? Insurance doesn't pay for it. It's so crazy. Yeah, I've done over 100 blood tests in the last 2 months, you know, at no cost for patients because they're concerned and stuff like that. But outside of research, you can't go to your doctor and says, please send me for a blood test to look for Alzheimer's. They're gonna like, what are you talking about, right? But that technology is coming. That technology will probably be mainstream at some point in the next few years, okay? The question is, what do you do with the results if it's positive? Right? That's what I'm gonna tell you today, actually, what you can do with these results if it's positive, because we're talking about prevention, right? Now, here's an interesting question. If Alzheimer's starts here, where you have your first memory loss, right? The mild stages of memory loss. If Alzheimer's starts here and it gets worse, how long has this Alzheimer's protein been building up before it causes problems? Anyone know?
20.
The Alzheimer's plaque has been building up for 20 years before the first symptom starts. Yes. Before the first symptom starts, this plaque has been building up for 20 years. Is that not crazy? Yes.
Are you gonna talk about what triggers it?
Absolutely. Right? Oh, his question is what causes the plaque, right? So would you rather find the plaque when symptoms start, or do you prefer to find it over here in the 20 years to try to do something about it?
Yeah, of course.
Right? That's the work we're in. That's the work I'm in, right? I'm looking for the plaque over here before it becomes a problem over here, right? That's the research we do and things of that sort. But in America today, we do not have a healthcare system. We have a sick care system where you gotta be sick before the doctor does something about it. Isn't that true?
Yeah.
Yeah, we're not focused on prevention. We wait till you got some kind of symptoms and then you come in.
Concept of, you know, don't fix it if it ain't broken.
Don't fix it if it ain't broken, huh? Except they don't know if it's broken or not inside until it's very broken, then you start having a symptom. That's a problem, isn't it? Yeah, I was a primary care physician, by the way, right, for almost 20 years, taking care of patients. I was in South County with, you guys heard of Memorial Care?
Oh, yeah.
One of their docs, right? One of their docs. For almost 20 years. I'm still with Memorial Care. I do a lot of teaching for Memorial Care. But in the 20 years or 17 years that I practiced medicine, most of my patients were older, from Laguna Woods. Anyone familiar with Laguna Woods? I had several thousand patients in Laguna Woods, and I saw the entire trajectory of Alzheimer's in my own patients. And these were my patients where I knew them when they were healthy, when they were doing well, they were younger, and I saw them as they got older, I got older, and I saw the slow changes in their memory over time. And whenever I made that diagnosis of Alzheimer's, I got depressed. Because I knew when you get that diagnosis of Alzheimer's, it was like a one-way road without a U-turn. You know what I'm talking about? Right? I was very successful in reducing the rate of heart attacks, reducing stroke, right? Catching cancer early, sending everyone for their mammograms, their colonoscopies, their pap smears. I was very successful doing all that. But the one thing that I felt hopeless was when I made the diagnosis of Alzheimer's. I just knew it was a one-way road. And so I left medicine as primary care medicine a number of years ago, almost 10 years ago, to focus on the brain. And so I went to research to find a solution with that. So we're doing clinical trials. And then I go out and I teach about it. as I learn stuff, I go out and I teach you guys, right? On what you can do to help with your brain. And so, my question to you is, if this thing's building up for 20 years before your first symptom, how do you know if it's there, number one? How many of you guys actually want to know if you got plaque or not in your brain? Serious? Why would you want to know? Aren't you scared?
Can't you treat it?
No? What would you do if you knew? Yes?
Well, besides anything that's preventive, it would help me plan with my family for what's gonna be happening.
Okay, plan with your family.
It would give me a better excuse when my wife is frustrated with me.
Yeah.
Forget
You have an alibi, an excuse now. I'm sorry, dear, I didn't remember that I had plaque. It's not my fault. I like that. I'm gonna start using that. I love it. I love it. It's the plaque's fault. Yes.
But amyloid by itself is not necessarily a killer, so to speak.
Great
From what I
question.
understand.
Great question. Is the plaque the chicken or the egg? Right? That's another question. Is it the chicken or the egg? Is it the cause of Alzheimer's or the consequence of Alzheimer's? Right? Chicken or egg? We're gonna go through that.
Okay.
With that. But we do know that the plaque is 100% associated with Alzheimer's, because if you don't have the plaque, you don't get Alzheimer's, right? So yeah, there's a lot you can do if you knew it was there. You can work on lifestyle and prevention. You can plan. You can blame it on the plaque when your wife gets mad, right? You could,
If you have certain goals, you can say, okay, I've gotta,
Do these
it's
goals
my
first.
time frame to accomplish these things, because after this point,
go take all the vacations you want,
exactly.
right? Maybe do that will, that living trust that you've been putting off,
Just in case.
right? Maybe plan financially, right? Maybe get that advanced directive in there. Because, I mean, you wanna get that done while you still have your brain, rather than somebody else deciding for you, right? All this advanced directive stuff. Makes sense with that. Maybe look at the will and, figure out whose name you wanna cross out. I'm just kidding, right? So there's a lot that can be done, and that's what we do. That's one of the main reasons why patients come to see me with that, is they wanna know if the plaque's there or not, and we give them that answer. And we do that, in research, though, it's part of our
When you give
research.
them the answer, do you also give them some kind of a quantification of the amount of plaque? Are you able to get that?
The blood test only gives you a yes or a no, right? Present or not present with that. But for those who do have plaque, by the way, most patients who come see me, 80% of the time, they do not have plaque. I get to give them reassurance. I get to give them peace of mind. So 4 out of 5 patients coming through my office don't have it, and we get to give peace of mind. Yes.
So you were talking about the plaque building up for 20 years, so if somebody comes in who's, say, 80 years old and doesn't have plaque, does that kind of mean they don't have to worry about Alzheimer's?
It's a good thing. If I don't catch it today, and it takes a lot of years to build up, right? They don't have to worry about it for a while. It's not a guarantee. You can't get it in 10 years or 20 years, but it takes a long
Well,
time
I mean,
to
if
build
they're
up.
80, 20 years down the road.
Sure.
100.
Yeah, I get it. Okay, what causes Alzheimer's plaque? What causes Alzheimer's plaque? That's your question. Because if we know what causes Alzheimer's plaque, maybe we can do something about it, right? What do you guys think? What causes it?
I know that I've heard that you don't have enough insulin in your brain, okay? Then that will, if you can make more insulin in your brain, it will help out the plaque.
So energy metabolism is when we talk about insulin and the lack of insulin. We do know that diabetics have double the risk of Alzheimer's compared to non-diabetics, right? And when you have diabetes, you have insulin resistance, or you have the lack of insulin when your pancreas is kind of burnt down. Make sense? So yes, that's one of many causes, not the only cause,
No, no.
right? Yes, yes. What else causes plaque, guys?
Is it for sugar?
Sugar is toxic, sugar leads to diabetes, right? Yeah, sugar is toxic, absolutely. The problem is, in the US, sugar is like everywhere. And I'm not just talking about cookies, ice creams, desserts, and cakes. I'm talking about carbs, right? White bread, white rice. What does that stuff break down to when it's digested? Sugar, right? Perhaps this is an epidemic because we eat the stuff every day, right? So there are over 30 different causes, over 30 different factors that lead to Alzheimer's plaque, okay? Rather than giving you all 30 plus factors, because you're gonna run out of note space, I see some of you guys taking notes in these little pieces of paper, right? I'm gonna put it into 3 different categories for you. I'm gonna categorize it into 3 buckets. By the way, I have an ebook on this I can send you guys. Anyone interested in an ebook on it? Cool, I'll give you my email later, or you can just send me your email address. You can just text it to me, that's fine. And I'll email you my ebook. That way you don't have to take all the notes. Okay? I mean, you could take notes, but I'll still, how many, yes?
Or doctor, let me comment while you mention it. If you really want to share that beyond more, you could send that to Sue and we'll make sure it's published in our newsletter so everyone, if it's okay for everyone to have access.
Absolutely okay.
That would be the quickest, easiest way to share it.
Yes, absolutely okay. Yes.
But it's also available on your YouTube channel.
Is it available on my YouTube channel, like the lecture? Well, it's being recorded now. You can always send me the link and I'll put it on YouTube.
They're all over YouTube.
You are?
You are.
Oh, I am. Oh. Yeah, I'm kind of everywhere. As long as I'm not in the post office, it's good. Yeah, you can Google my name and kind of find me all over the place. Yes. And yeah, I have a podcast. It's called Health Talks with Dr. Trin, and I'm on Facebook as Health Talks with Dr. Trin and all that. So yes, I love education. That's why we're in social media and we educate the public. And it's not always Alzheimer's. It's on cancer and longevity and different topics. So there's over 30 different factors that are associated with Alzheimer's plaque buildup. And I'm gonna categorize it for you into 3 different categories with that.
So far, you've been speaking of Alzheimer's plaque. All right, we know that plaque is also associated with other conditions.
Yes, like heart plaques,
PSP.
PSP. Yes, this is a different plaque. All the plaques are different.
Okay.
So the Alzheimer's plaque is not the same plaque that builds up in your coronary artery that leads to a heart attack. That's a cholesterol plaque.
Right.
Right, the Alzheimer's plaque is beta amyloid plaque. That's the name of that plaque. It's very specific to Alzheimer's.
Okay.
Absolutely.
You're only testing for the Alzheimer's plaque.
That's correct.
Okay.
That's correct. In our research, we just test for the Alzheimer's plaque. Absolutely. The plaque and the tau tangles, they kind of go together with that. So, category number 1, okay, bucket number 1, I call them like the 3 buckets that catches plaque, right? Bucket number 1 that leads to Alzheimer's and increases the risk of Alzheimer's is the circulation bucket. Circulation bucket. What do I mean by that? Any condition that causes poor circulation to your body, to your heart. That poor circulation doesn't stop at the neck, does it? It leads to an increased risk for Alzheimer's. If I took 10 patients with Alzheimer's, 8 of those 10 have high blood pressure. Because what does high blood pressure do to your circulation? Right? It messes up circulation. So 8 out of 10 patients with Alzheimer's have high blood pressure. If I took 10 patients with Alzheimer's, 4 of those 10 have diabetes. Diabetes or Alzheimer's is sometimes called diabetes type 3. Alzheimer's has been often called diabetes type 3, just because it's so common in diabetics, right? Those who have diabetes have double the risk of Alzheimer's as those who don't have diabetes. Why is that? Because sugar is toxic to the brain. Excess sugar is toxic to the brain. It promotes inflammation. Sugar is pro-inflammatory. Make sense?
Yeah.
Yeah, I'm seeing some sad faces here. Right? With that. So 10 patients with Alzheimer's. By the way, when we think of diabetes, we don't think of circulation problems, we think of sugar. But what is the end result of diabetes? Why do diabetics die? Heart attacks and strokes. Heart attacks and strokes is why diabetics die, right? So the end result of diabetes is circulation. Okay, the high blood sugar messes up the circulation. So diabetics die from heart attacks and strokes, right? Number one reason for amputation below the knee is what? Diabetes, poor circulation. Number one reason, right? One of the number one is for diabetes that's uncontrolled is diabetic retinopathy, circulation, right? Peripheral artery disease, poor circulation, diabetes, number one risk factor, right? So the end result of diabetes isn't sugar, it's circulation. So 10 patients with Alzheimer's, 8 of those 10 high blood pressure, 4 of those 10 diabetes, 3 of those 10 heart disease, and many have high cholesterol. What does high cholesterol do to your circulation? It clogs it up, right? This is why we want to lower bad cholesterol. It clogs it up. So high cholesterol is a risk factor for Alzheimer's. And this is scary because when I think of diabetes, high cholesterol, high blood pressure, these are all the symptoms or these are all the risk factors that leads to a heart attack. Right? These are all the risk factors that lead to a heart attack. So heart disease and Alzheimer's, they share the same risk factors. Cholesterol, diabetes, blood pressure, lack of exercise, obesity, these are all the same risk factors that lead to heart attack. They're the same risk factors that lead to Alzheimer's. This is probably why heart attack is number one cause of death and Alzheimer's is number 3 cause of death, because they have to share the same risk factors. That's why they're so linked and close together as number 1 and number 3. Make sense? So if you want to lower your risk for Alzheimer's, simply lower your risk for heart disease. Same risk factors, guys. Make sense? So circulation is bucket number 1, right? Category number 1. Bucket number 2 that leads to Alzheimer's is the inflammation bucket. Inflammation bucket. What does that mean? What is inflammation, guys? What is inflammation? Swelling, that's a symptom. Yeah, what exactly is inflammation?
Body rejecting something.
The body rejecting something or the body fighting something. Absolutely. How many of you guys have had the flu before? What's one of the first symptoms of the flu? Fever. Did you know that a fever is just inflammation? That's all it is. A fever is just inflammation. A fever is when your immune system sees the flu virus. And when it sees something that should not be there, it attacks it, okay? The immune system attacking the flu virus. In the process of the attack, the byproduct of that attack, the byproduct of the fight is called inflammation. Does that make sense? Inflammation is the byproduct of the immune system fighting something that should not be there. That's why you have a fever. Your body heats up in the fight. Right? So it could be a virus, it could be a bacteria, it could be a toxin, it could be a mold, whatever should belong in your body, right? Anything that the body does not recognize, the immune system fights. And the byproduct of that is simply inflammation. Does that make sense so far? So inflammation is not necessarily bad. Okay, it's just your immune system fighting something that shouldn't be there. But what's bad is this. What if you had a fever every day of the month? Is that good or bad? That's bad, right? So what's bad is chronic inflammation, long-term inflammation. Because what happens is, long-term inflammation is like going to war, going to battle, trying to shoot the bad guys and accidentally shooting the good guys. Chronic inflammation harms its own body. The immune system's shooting everywhere. It's just shooting randomly, harming its own body. Does that make sense? Right? Inflammation, chronic inflammation is behind chronic disease. Did you know that? Did you know that most of the diseases we have today is probably linked somehow to inflammation, to chronic inflammation? Most of the diseases we have today, we just don't realize it. Let me give you some examples. You can pick any organ system in your body, right? Lungs, heart, any organ system, pick a few diseases of that organ system, and I bet I can link it to inflammation somehow. Yeah, pick an organ system. How about your lungs? What are some diagnoses of the lung? What are some conditions of the lungs? COPD is simply inflammation of the alveoli sacs. Emphysema is simply inflammation of the alveoli sac. What other conditions of the lungs?
Fibrosis?
Fibrosis is scarring from chronic inflammation of the lungs. Asthma. Asthma is inflammation. Asthma is when your immune system does not like something that it was exposed to, like cold-induced asthma, exercise-induced asthma, asthma from smelling a perfume. The immune system doesn't like it, so it triggers inflammation. And when it triggers inflammation, it makes mucus production as a side effect of that. And when you have mucus in your lungs, you start to wheeze. So the wheezing of asthma is simply a sign of inflammation. Asthma is inflammatory. Bronchitis. Bronchitis is just inflammation of your bronchial tubes. So do you see how just with the lungs, we've had several different diagnoses, but they're all linked to what? Inflammation. Pick another organ system besides the lungs.
Ears.
Hmm?
I had it here.
Kidney, okay, yeah, kidney. Anyone heard of glomerulonephritis? Right, that's inflammation of the glomerular tubes of the kidneys, right? Kidney stones, if they get stuck, right, very painful, produces an inflammatory response. Cystitis is inflammation of the bladder. Right? Inflammation, kidneys. What about the GI tract? What are some conditions? IBS, right? Irritable bowel syndrome is inflammation when the gut doesn't like something that it's exposed to. With that, have you heard of Crohn's disease?
Yeah.
That's just inflammation of your intestines. Have you heard of ulcerative colitis? That's just inflammation of the colon. Acid reflux is just inflammation, right, of your stomach, your esophagus from excess acid. That's inflammatory. Ulcers is just inflammation, right, produced by a bacteria called Helicobacter pylori. Right? When I went to medical school back in the early 90s, you know how we treated ulcers back then? Back in the 90s? Yeah. Yeah. When I went to medical school, an ulcer you treat with Tagamet, Pepcid, Mylanta, right? But as the years go on, we've learned that 90% of stomach ulcers is an infection. caused by a bacteria called Helicobacter pylori. It's very interesting, isn't it? Medicine, like whatever you're learning in medical school today, 50% of it is gonna be gone in the next 10 years. Absolutely, absolutely, it's very interesting. So the GI tract, right? We call out all these different conditions of the GI tract. Inflammation, 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 right? Acid reflux, Crohn's disease, ulcerative colitis, all inflammation induced. Hepatitis is inflammation of your liver. Pancreatitis, inflammation of the pancreas. Appendicitis, inflammation of the appendix. Diverticulitis, inflammation of the pockets. Cholecystitis, inflammation of the gallbladder. Do you see a trend here with inflammation and diseases? That's just the GI tract, guys. What about, I don't know, your skin? What are some skin conditions? Eczema, inflammation of the skin. Dermatitis, inflammation of the skin. What else?
Knee surgery.
Knee surgery? That's arthritis.
After knee surgery, no, after knee surgery though, I've been totally dealing with inflammation and swelling. The swelling would slow down my recovery.
Yeah, post-surgery swelling, which is inflammation, yes. Psoriasis.
Dry skin.
Yes, psoriasis is just inflammation of the skin, right? All these different conditions, all linked to inflammation. What about your joints? She just had knee surgery, right? So all types of arthritis is inflammation. Every arthritis is simply inflammation of your joint, whether it's gout, rheumatoid arthritis, osteoarthritis. Any type of arthritis is inflammation of your joint. Isn't that crazy? What do you call inflammation of the brain? Inflammation of the brain, I call Alzheimer's disease. Yeah. How do we know that? We know that because when we do autopsies of brains of patients with Alzheimer's, we find the plaque, the amyloid plaque, the tau tangles, which is another protein associated with Alzheimer's, and then we find inflammation in the brain. The three things that's consistent with every autopsy of Alzheimer's disease: plaques, tangles, and inflammation. Yeah, inflammation, Alzheimer's disease. So that's bucket number 2, the inflammation bucket, right? This lecture is just going downhill, huh? I mean, when we're done with bucket number 3, we're just gonna kick the bucket.
Yeah.
It's just downhill.
Downhill.
Downhill. Okay, bucket number 3. Bucket number 3. Bucket number 3 is toxins, toxicity. Give me some examples of toxins, guys.
Alcohol.
Alcohol's a toxin, sugar's a toxin. What else?
Dairy.
Dairy, okay.
Tobacco.
Dairy could be a toxin.
Tobacco.
Tobacco, obviously smoking, yes.
Prescription drugs.
Prescription drugs, yeah, I mean, side effects, right? Too much of anything is bad, side effects. Not just prescription drugs, even vitamins, supplements. If you take too much of something, it becomes a side effect, right?
B6.
Right? Too much of something isn't good.
What about gluten?
Gluten, yes, gluten is irritating the immune system, right?
Preservatives?
Preservatives are toxins because they don't belong in your body, right? Think of the American diet. Half the junk we eat, have you ever looked at these labels? When I go to the grocery store and I look at a label, I don't recognize half the stuff on the label. Try looking at the labels of these ingredients of the food we buy. I don't recognize half the stuff on there. When you don't recognize the ingredients in the label, it's no longer food. What you're eating is you're eating chemicals with food flavoring. Isn't that what, who's the guy, is it RFK's trying to do something about it?
Yeah.
Is that him? Yeah? Election's done, we shouldn't even talk about it, right? And RFK is going on the Trump administration to talk about how to get rid of all the junk in our food and things of that sort. That's a good plan to get rid of all the junk in our food, because you realize that what we eat here in America, half the stuff is banned in other countries. Pesticides, Monsanto, right? You go to Europe, they ban half the stuff that we're allowed to eat here. Scary, isn't it? And you wonder why Alzheimer's is an epidemic. You wonder why chronic disease is such an epidemic in the United States with that. So toxins, absolutely. Preservatives, right? Food coloring. Even the air we breathe. Did you know that if you live in a city of high air pollution, your risk of Alzheimer's is higher than if you live in a city of low air pollution? Absolutely. That's been published. Right? So toxins, it comes from the air, comes from the water, it comes from the food we eat. What about all this stuff now about microplastics? A lot of data is coming out, guys. A lot of published data is coming out. Microplastics, nanoplastics. Right? The water bottle we drink. If that water bottle heats up, what is seeping into the water? The stuff from the plastic. Right? You think that's healthy when it's in your body? Absolutely not. We are finding microplastics in the plaques of the arteries that leads to heart disease. We're finding microplastics in the brain, right, in our organs. We're finding it now. We're just starting to find it now. And the scariest thing is, most of the stuff we eat is like in plastic somehow. Think about the take-home food. When you go to a restaurant, you take home food, what do they put it in? Something plastic. And then what do you heat that food in? The same container. The microwave, right? Think about that stuff that comes into our body that should not be there, that nobody's talking about. Yes?
Relate this to the blood-brain barrier, because my understanding is just to get some chemicals into the brain, they have to break down that barrier to get stuff in. So the things we're talking about, are they getting into the brain, or
They are.
how
We
they?
are finding them in the brain. We find them on these autopsies of stuff that shouldn't be there. Infections, viruses, toxins, mycotoxins from mold, we're finding in the brain, right? Dental infections, gum disease, right? The bacteria, P. gingivalis, the toxins of the gum disease we find in the brain. Herpes simplex we find in the brain. Absolutely. So the blood-brain barrier gets compromised with inflammation. Yes?
Does tinnitus have anything to do with any of this?
Tinnitus is different. Tinnitus is ringing of the ear from an inner ear, middle ear issue. You're like, woo. But hearing loss is a risk factor. Hearing loss is an Alzheimer's risk factor, yes.
How is using vinyl wrap and heating food?
Vinyl wrap and heating food. You think that if you microwave that vinyl wrap, some of that stuff is not leaking in? Right?
Can you explain hearing loss and Alzheimer's a bit more?
Sure, I'll be glad to. We'll get to that section.
Oh, cool.
We will talk about prevention and all that, right? But toxins, guys, toxin isn't just from the air. Toxins is mainly from the food. How many of you guys are like me where you enjoy a medium rare steak? Yeah. So if you're like me where you're, I'm gonna ruin your meal here, huh? What's for lunch today? Or I'll just go out and drink water. If you're like me where you enjoy medium rare steak, Are you just eating a medium rare steak? What else are you eating?
With the cow.
You're eating what the cow ate,
Yeah.
right? So if the cow ate grass and the grass was sprayed, that's what you're eating, right? Yeah, so you could be eating pesticides, herbicides, you're eating what the cow ate.
You're ruining our steaks.
I know. I'm not saying, well, I don't know. So you're also eating what was pumped into the cow. What do we pump into our cows? Why do we pump antibiotics into our cows?
Make it have more.
So they don't get sick and die, right? Loss of profits if your cow gets sick and die, loss of profit. So throughout the life of the cow, they pump antibiotics. So when you're eating a medium rare steak, guys, you're not just eating a medium rare steak. You got antibiotics, you got pesticides. What else are we pumping into our cows besides antibiotics?
Hormones.
Hormones. Why would we do that? Make them grow fatter, faster, more profit, right? Sell it by the pound, right? More profit. So when you're eating a medium rare steak, you're not just eating medium rare steak or just beef in general, right? But I'm no longer talking about steak, am I? Don't we have to watch our chicken now? When you buy chicken, you gotta look at the label now. Like 10 years ago, I didn't even think twice about the label on chickens. Did you think twice about labels on chicken 10 years ago? Now you gotta go look on the label to see if it says no antibiotics, no pesticides, no whatever hormones, right? Don't forget the eggs. So it's not just steak, it's chicken, it's the eggs, right? And guess what? 10 years ago, they probably had the stuff in there, but it wasn't put in law that you have to disclose it. Right? Just wasn't put in law until recent. Think about that. The food industry, guys, the food industry knows that sugar is addictive.
Well, they love it, they're gonna keep it up.
So what they do is they add sugar to just about everything, right? They add sugar to just about everything. Sugar is toxic for the brain, leads to diabetes, right?
Fructose.
And so what they do is the food industry, they hide the word sugar and they use different words for it on your label. What other words do we use?
Fructose.
Fructose,
Cane juice.
corn syrup, right? Sucralose,
Milk.
right? And so they know this, so rather than sugar, they have different words to hide. Make sense?
Yep.
Because they want you to go back and buy the same food because you get addicted to the food because of the sugar content in it, right? Sugar stimulates your endorphins, it stimulates your dopamine, you get that wow, you want that food again, you wanna go back and buy the same thing, right?
Is honey bad for you?
Is honey bad? Honey's more natural.
I know.
Honey's more natural, right? It's the processed sugar, that's the problem. It's the processed white sugar, because the immune system doesn't recognize that, right? It spikes your blood sugar, right? It leads to diabetes and things of
How
that
about
sort.
fructose? Some doctors say fructose is okay.
If it's from a fruit, we don't worry about it. If the sugar's from a fruit, we don't worry about it. God made the fruit, right? Nobody gets diabetes from eating too many fruits. We get diabetes from eating too many carbs. Make sense? Right? You love chips? Me too. Yeah, once in a while I love chips, right? Yeah. Once in a while I lose a few brain cells over it. So this is what I talk about when I talk about toxins. It's in the food we eat every day. So think about it. As your stomach is digesting the medium rare steak, as it's digesting the medium rare steak, into your bloodstream is now floating pesticides, growth hormones, antibiotics that was in that cow, right? What does the immune system do when it sees something that it doesn't recognize? It attacks it. It attacks it. And in the process of this attack, what is created? Inflammation. Inflammation. And if we only ate a steak, if we only ate something bad once a week, no big deal. You get a spike of inflammation, it goes away, no big deal. But how often are we exposed to this type of food? Every day. It is called the American diet. So every day, your immune system is attacking the food you eat. The preservatives, right? The hormones, the antibiotics. Every day, the food coloring, the fried food, the sugar, right? Every day, this battle is going on with the immune system versus the food you eat. So every day, you are creating inflammation. When you create inflammation every day, it is now called chronic inflammation. Yes?
Is the medium rare steak worse than just a well-cooked?
Medium rare steak versus
I mean,
well
it's
cooked.
medium rare, so is it-
I shouldn't blame it on just the steak, right? It's just everything we eat has junk in it.
But by not cooking it as long, is there more of it getting into you than if you cook it longer?
It depends. I mean, it gets denatured. You break down the antibiotics and all that if you cook it longer. But, I mean, fried food isn't that great either, as far as health is concerned, right? If you're overcooking it or frying it or things of that sort. So what I'm really saying, guys, is that we are eating ourselves to Alzheimer's. It's a lifestyle thing, more than genetics. Alzheimer's is more lifestyle than it is genetics. Yes, there's a gene for Alzheimer's. There's more than one gene. There's like 70 plus genes that's been associated with Alzheimer's. The most common gene is called the ApoE4 gene, right? That's associated with Alzheimer's. That's the most common one that we look for. If you've ever done 23andMe, where you're checking, all your genetics and all that, that Alzheimer's gene is actually in the test. People don't realize it, it's in there. If you've ever done 23andMe, the Alzheimer's gene is in there. They look for it, right? Yes. 23andMe.
No, that
Oh,
gene.
ApoE4. APO, letter E, number 4. Right? So here's the thing with genetics. If you have the gene, it does not condemn you to the diagnosis. It does not guarantee you're going to get Alzheimer's. Why is that?
Some are recessive.
Because lifestyle is more important than genetics. Make sense? Lifestyle is more important than genetics. If you do not have the gene, if you do not have the Alzheimer's gene, it does not guarantee that you won't get Alzheimer's. Why is that? Because lifestyle is more important than genetics.
Whether it's external influence instead of internal.
External influence is more important than internal genetics when it comes to Alzheimer's disease. Make sense? It's good news, bad news, because lifestyle, you can do something about it. Make sense? Lifestyle, you can do something about it. So here's the thing. In today's world, and here's why Alzheimer's is such an epidemic. I want you to imagine, I talked about the 3 buckets. Bucket number 1, circulation. Bucket number 2, inflammation. Bucket number 3, toxicity, right? The 3 buckets that lead to Alzheimer's production. In today's world, and with the diagnosis of Alzheimer's, we are catching this disease way too late. Because when our symptoms are only mild, what do we blame it on? Old age, right? It's a big problem. Plus, the other thing is, how many minutes does your doctor have with you in an office visit? 5 to 10, 15 if you're lucky, right? I mean, in this 10-minute, 5-minute, 7-minute visit, your doctor is dealing with whatever you're there for, your chief complaint. They're refilling your meds, they're putting in referrals, they're reviewing lab results. Where is the time to talk about memory or Alzheimer's?
Well, even talking about what your test just got you took.
Right.
To distribute it to, okay, what does that mean?
Yeah, yeah,
To
that's-
all of us.
absolutely, it's no time.
There's a lot of.
There's no
depth-
time.
There's a lot of depth in that.
Yeah, primary care is not the same as it used to be. Remember the days where you actually knew your doctor and they knew you? Does that day exist anymore? If you're lucky, yes. But these days, you're seeing a nurse practitioner, a PA, right? And these days, it feels like you're just kind of, assembly line, real quick, in and out. Somehow along the line, along the years, that doctor-patient relationship's kind of slipping with that. It's kind of sad. It's kind of sad. I see it. Part of it is the system, not the doc. Because now your doctor's not even looking at you, right? As you're talking, what are they doing? Type in the computer, right? Now they'll look over and then type. They gotta document everything.
Yeah.
Right? Remember the days when your doctor actually spoke to you? Eye to eye. Half of them are typing now, right? EMR. I mean, the technology is good, but you kind of lose some of that human touch. This is why Alzheimer's is getting missed. There's no time to look for it, no time to talk about it. Patients aren't looking for it because they're blaming it on aging. Doctors don't have time. When is the last time, how many of you guys get once a year in memory tests? I see maybe 3 hands in this group. Isn't that a problem? Think about the top 3 causes of death. Heart disease is number 1. We do everything we can to detect heart disease. We check your cholesterol, right? We look for diabetes. We tell you to exercise. We tell you to be on a low-fat diet. We tell you to lose weight. All that to what? Prevent heart disease. Make sense? We do everything we can. We do EKGs during your physical. Sometimes we put you on a treadmill. We do everything we can to prevent heart disease. Number 1 cause of death. Number 2 cause of death, cancer. We're sending you for mammograms. We're sending you for colonoscopies, pap smears, prostate exams. We're looking for cancer, aren't we?
Yeah.
We're doing everything we can to detect cancer early. What are we doing for the number 3 cause of death, guys? Nothing. Think about that. Yes?
So, back to the, test, do you have plaque or not? Oh, yes, you do. So, if yes, you do, the question is there, besides the lifestyle modifications, is there some sort of a drug either available now or being researched that can, like, say, melt the plaque or stop the plaque from adding something like that?
That's the work I do. That's the work I do. I do it at no cost because in research you don't need health insurance or anything. People come to volunteer for these things, right? It's research, it's clinical trials. That's the work I do. We have clinical trials that are removing the plaque from the brain. So we do that type of work. The answer is yes. But my preference is this. Let your food be your medicine. Always before you think about a pill. Let your food be your medicine, right?
Brain food.
Brain food, right? I'm in the world research, I'm researching medications and drugs, but let your food be your medicine. with
So
that.
is there food that can make plaque go away, or just the dietary change stops the plaque from continuing to
Stops from
build up?
continuing,
I
yes.
was gonna say, a lack of food be a solution as well, meaning fasting for periods of time.
Fasting, fasting's another 3-hour lecture. I'm giving that lecture at different churches. Yeah, I've and intermittent fasting and things of that sort. With that and longevity, we do that kind of talk all the time. Yeah, so
Is it worthwhile to intermittent fasting?
is it worthwhile for intermittent fasting? Yes, there are pros and cons. When you guys want to lecture intermittent fasting, I'll come back and teach you how to do it right. And the benefits.
Next week?
Next week? You can ask Pastor Ron, right? Set it up, whatever. Next week, I can't, I'm speaking at a different church next week with a different topic. Next week, I'm talking about, I think, longevity at St. James Church. But yeah, you set it up, I'll come back and this is my ministry, right? I'll come back and teach you guys whatever you want to learn. So here's the thing. Imagine, I want you to imagine your brain. Imagine a house. Go on a little imagination journey with me. Imagine a house, okay? Here's a house. And in the living room of that house is your brain. The brain takes up the entire living room, okay? And the house has a rooftop on it. And I want you to imagine that it's raining. It's raining. Does anyone remember the word rain anymore? I'm just kidding. It's raining, right? But it's not normal rain. It is the rain of medium rare steak. It is the rain of sugar. It is the rain of air pollution. It is the rain of high blood pressure. So it's toxic rain, right? Over time. What happens to the roof over time as it keeps raining?
Sag.
It's going to wear out. It's going to start leaking, right? It's going to start leaking. And in the beginning, you only have maybe one leak. One leak, right? And in one leak, it's mild. It's forgetting a name, a word. But over time, as the rain continues, 2 leaks, 3 leaks. Now you're cooking, you forget to turn off the stove. Now you're putting the keys in the refrigerator. More leaks, more leaks. You're driving, where am I at? Right? More leaks. What happens is this. Raindrop goes through the roof because it's toxic. And as it goes through the roof, it hits your brain in the living room. Right? Toxic raindrop hits the brain in the living room. Raindrop hits the brain, plaque production. Raindrop hits the brain, plaque production. Raindrop hits the brain, plaque production. Right? The plaque production, the Alzheimer's plaque, is the result of all these toxins coming at it. Make sense? Plaque production. Raindrop hits brain, plaque production. And this is what I see in the office and as a primary care doctor. When a patient comes in to me as a primary care doctor, and sometimes it's the patient's family member and loved ones that drags in the patient, right? Saying, my loved one has memory loss. Doctor, my loved one has memory loss. What I do is I open up their medical records. What do I see? I see multiple leaks in their roof already. It is late, the damage is done. I see diabetes, I see high blood pressure, I see high cholesterol, I see obesity, I see medium rare steak, I see the American diet. Right, the damage is done, and I'm like, wow, there's multiple leaks in this roof. What leak am I gonna try to plug first? This is why Alzheimer's is an epidemic. Because by the time a patient comes into the doctor's office, there's already multiple leaks in their roof. Does that make sense? It's like trying to stop a runaway train at 70 miles an hour. It's late. So what can we do to solve this problem? What can we do? What we need to do is go to the front of the disease and protect the roof. Make sense? Protect the roof. This is why I go out to give these lectures, because nobody's aware that Alzheimer's is lifestyle. Okay? So how do you protect the roof? I'll give you a list. There are actually 14 factors, modifiable risk factors, that contribute up to 50% of all Alzheimer's. Did you know that? Half of all Alzheimer's globally is contributed by 14 things. If you got 14 things under control and you reduce the risk of these 14 things, you'll cut your Alzheimer's risk in half already. Crazy, isn't it? You want me to send you a list?
Yes.
Yeah, it's gonna be in my ebook when I send it to you, okay? But I can give you a list right now, just from what I remember. My memory's poor. So I can tell you right now, right, these 14 things. Number 1, diabetes. Right? Remember, if you have diabetes, it doubles your risk of Alzheimer's than if you don't have diabetes. That's number 1. Number 2, hypertension. I'm not talking about controlled hypertension. If you have high blood pressure, but it's under control, that risk goes away. Make sense?
Really?
If you have diabetes and it's under control, you reduce that risk. I'm talking about uncontrolled conditions. Okay? Hypertension, diabetes, high cholesterol is on the list because high cholesterol clogs up what? Your circulation. Circulation is bucket number 1. Remember that? Bucket number 1, circulation. High cholesterol affects circulation. Okay? Obesity is on the list, believe it or not. Those who are obese have a higher risk of Alzheimer's than those who are not. And it's not because your body's like, you're fat, you're gonna get Alzheimer's. It's not that. It's the factors that lead up to the obesity. Okay, whether it's an exercise issue, a food issue, whatever it is, right? Obesity is just a consequence of that. Did you know that obesity is tied to 13 cancers? There are 13 cancers tied to obesity. And it's not because the body's like, you're obese, I'm gonna give you cancer. It's the factors that lead up to that. And what's interesting is this. Forever, we have been taught that if you want to lose fat, you need to go on a low-fat diet, right? Lose fat, low-fat diet. Lose fat, low-fat diet. Like when you guys are eating a steak and you see a rim of fat around the steak, what do you normally do with it? You trim it off, right? Trim off the fat. Some of you guys eat it. Right? You trim off the fat. Most of us do that. We've been taught to trim off the fat. But if we're all trimming off the fat, why is it that in the United States, 2 out of 3 of us are overweight? Based on the BMI index, body mass index. Why is it that in the United States, 2 out of 3 of us are overweight if we're all trimming the fat?
Because we're not all trimming the fat.
Because you're not all trimming the fat. Yeah. Yeah,
Well, we trim
partially.
the fat, but we eat all the sugar and all the other stuff.
Fat doesn't make fat, carbs make fat.
Sugar makes fat. Nobody's watching their carbs. When you have carbs, it breaks down the sugar. Excess sugar is stored as energy, which is fat.
Carbs are broken down into sugar, which
Carbs.
is fat.
Exactly. Nobody's watching their carbs, they're watching their fat. But we are a carb-based diet, right? We got bread every day, rice, potatoes, and all that. We're, pasta, pizza, we're a carb-based, right, diet. It's the American diet. So the sugar is getting into the fat cells, making us fat. That's why obesity is linked to Alzheimer's, because of the sugar that is getting in there, making us fat. Make sense? Obesity is on the list as an Alzheimer's risk. There are a number of toxins. Alcohol we talked about, right? Excess alcohol damages the brain. Smoking is on the list. Smoking is on the list, right, of the 14 modifiable risk factors. Air pollution is on the list. Air pollution is on the list, 14 modifiable risk factors. Social isolation is a risk factor. Social isolation, which means if you socialize on a regular basis, you lower your risk of Alzheimer's compared to somebody who's home all day not socializing. What is socializing? It's this, being here, right? Going to church, being part of a fellowship or group, small group, Bible studies.
So when you're socializing, you're exercising your brain?
Yes, when you're socializing, you're exercising your brain. When you're socializing, these brain cells are talking, they're communicating, they're chatting. The brain is a muscle. Use it or lose it. When you're socializing, you're using your brain. Make sense? Absolutely, the brain's a muscle, use it or lose it. When you're not socializing, the brain just withers away. Gotta figure out ways to socialize, yes.
That's why they say loss of hearing is got possible consequences of Alzheimer's?
Yes, loss of hearing is a risk factor for Alzheimer's. Why is that?
Because you're isolated.
If you can't hear the other person, you're not having that social interaction.
Yes.
and
So our brain is stimulated by the 5 senses. What we see, what we hear, smell, taste, touch, right? What we see, what we hear, smell, taste, touch. The brain is stimulated by the 5 senses. When you can't hear, you're losing an entire portal of brain stimulation. When you can't hear, it increases the risk of Alzheimer's by 40%. 40% risk increase when you can't hear. But that 40% risk goes away with a hearing aid, which most men don't wear. I know about it, I hear it. The wives bring them in. Like, my husband, he's not listening to me. Is it a hearing aid problem or is it a selective hearing loss problem? I'm not quite sure.
See, all of the above.
All the above, right? He's not listening to me. I'm like, okay. So hearing loss, that's why it's a risk factor. The lack of stimulation of brain.
My mom has Alzheimer's. She does all most of the risk factors don't apply to her, except she grew up in India, pollution and chronic asthma. So could that?
Absolutely. Pollution is huge because you get the toxins every day, right? The other risk factor, other than hearing loss, is vision loss. For the same exact reason, the lack of stimulation, right? Vision loss could be uncorrected cataracts, right? Glaucoma, macular degeneration, not fixed, right? It's that lack of stimulation, same thing. But no, how many have I said so far? I lost track.
I think 10 or 11.
10 or 11? Next one is physical inactivity. Physical inactivity is a risk factor. So we know that those who exercise on a regular basis have a lower risk of Alzheimer's than those who don't exercise. What do I mean by exercise? 30 minutes a day. Do something to get your heart rate up. It could be walking. You don't have to run or bike. It could be walking, right? It could be a stationary bike. You want to get your heart rate up half an hour a day. Now, if you can't walk half an hour because the back hurts, the knee hurt, the joints hurt, do 15 minutes twice a day. 10 minutes 3 times a day, as long as it adds up to at least half an hour a day. Those who exercise have a lower risk of Alzheimer's than those who don't exercise. Because when you're exercising and your heart's pumping, what are you improving up to your brain? Circulation. Remember that bucket, the circulation bucket? Exercises addresses the circulation bucket. Makes sense, right? This is all common sense with that. Oh, the other exercise you should do is brain exercise. Do something to keep that brain thinking. For some people, it's playing chess, checkers. For others, it's taking a class. For others, it's learning a new language. For some, it's Sudoku.
Yes.
Right? I don't know, do you guys have bridge here? Is there a bridge club here? Or
Word search.
Word search, right? Right? If we're in
Connections and Wordle.
Wordle, yeah. Solitaire.
Is simply reading included in that?
Reading is good. Reading is not as active, but it's good. It's better than not reading. Yes?
Social dancing.
Social dancing, I love it. Love it.
In front of the TV?
In front of the TV. Dancing hits several parts. Dancing addresses the socialization. Dancing addresses physical movement, right? Exercising, dancing hits several parts of the brain. And brain exercise is part of dancing if you're like thinking about where to put your feet and all that. Dancing's good with that, okay? Another one, what number are we on? 12?
How about stress?
Stress reduction, yes. Did you know that depression is a risk factor for Alzheimer's? That's depressing. Right? Get more depressed.
But exercise reduces.
Exercise reduces depression, right? And the reason depression is a risk factor for Alzheimer's is severalfold. First of all, if you're depressed, do you want to go out and do things? No, you want to stay home. You want to isolate. That's a problem, right? The second thing is stress and depression. It increases the body's cortisol level, which is what we call the stress hormone, right? Cortisol level. Chronic cortisol level production is not good for the brain. Make sense? Stress hormone chronically, not good for the brain with that. Okay?
Just bad thoughts.
Bad thoughts, yeah. So stress and depression is a risk factor. And lastly, number 14. We're on number 14 now, right? Traumatic brain injury. Those who have had repeated brain injury, right, is a risk factor. So we see folks who come in and they used to be soccer player, they used to be football players. Yeah, those are risk factors that we see with that traumatic brain injury. And that's modifiable, just try to avoid those type of activities, right? With that. Did I give you a list of 14? Just simply this list of 14 contribute to 50% of Alzheimer's globally. You can cut down your risk of Alzheimer's in half, guys. None of this is all lifestyle that I've talked about. Yes?
So is the other half your genes?
So what is the other half? Part of it is your genes, but genetics is not 50%. Genetics is maybe 10%. Okay? The other 40% we know about, but they haven't documented yet as a risk factor to reduce the risk. What's interesting is that in 2020, when everyone was thinking about the pandemic and shutting down and all that, in 2020 there was an article that was published by a medical journal called The Lancet. Anyone ever heard of that? Yeah. So The Lancet published a journal, a very important paper from what's called the Lancet Commission, a group of physicians that got together. And in 2020, they listed 12 conditions that contribute to 40% of Alzheimer's. 12 conditions that contribute to 40% of Alzheimer's. This year at a conference called AAIC, Alzheimer's International Conference, which I go to every year. I just came back actually from Madrid last week, where I went to another Alzheimer's International Conference. But this year, they added 2 more to that list of 12. And when they added from 12 to 14, it went from 40% to about almost 50%, lowering your risk of Alzheimer's. It's like 45%, 46, something like that. So my guess is in a few years, they'll keep adding risk factors to this list so that you're gonna realize that Alzheimer's is all preventable. Crazy, right? Crazy.
Preventable but not curable.
Ooh, let's talk about what we can do. So let's say you saw me in the office and you got a blood test. Let's say you wanted to do that, right? And you're welcome to do it if you wanted to. Let's say you saw me in the office, you got a blood test. 4 out of 5 of you, I would call you and say, guess what? I don't see the Alzheimer's protein. You're good to go. Cross off Alzheimer's off your list. How many of you guys want to cross Alzheimer's off your list? Right? So I give that news to 4 out of 5 patients that come see me. If you're interested, I'll give you your office number later. You can always call us. Right? Everything we do is no cost with that. And as a matter of fact, part of what we do is we give you a memory test and we'll tell you how you did, because I know your doctor is not doing it. So we provide free memory tests and consultations to folks so that they can know if they're at risk or not, right? If you wanna know if you're at risk or not. But what if you're the 1 out of 5 patient where we see the plaque? Then what? If I find the plaque in your blood, the first thing I can tell you is that this is not a diagnosis of Alzheimer's. Okay? This is not a diagnosis of Alzheimer's. Because I'm catching the plaque over here during the 20 years while it's building up. Make sense? If your diagnosis of Alzheimer's is over here and the plaque's been building up for 20 years, that's where I'm catching it. So it's not a diagnosis of Alzheimer's. I'm catching the plaque that leads to Alzheimer's. Does that make sense? So that's what I tell my patients. It's not a diagnosis of Alzheimer's, do not panic. The second thing I tell my patients is that, guess what? It's better we found it today than a year from now, when things may get worse. Because the point of this is to be proactive, right? It's better that we found it now than a year from now, when you may have lost more brain cells. As plaque builds up, brain cells go down. Make sense? We lose brain cells with that. So we do this to be proactive. We do it for the purpose of prevention, right? We have these studies called prevention studies where we're looking for it early while you still have your brain cells with that.
Do they actually go away, or do they become disconnected from the rest of the network?
The brain cells, they go away. And we know that they go away because the brain size decreases and gets smaller. So they go away. And we're not bringing dead brain cells back. That's the problem. Right? So if I find something and I caught it late, I can't bring those dead brain cells back. This is why we're out here telling people to be proactive about all this. Okay?
Non-reversible.
Yeah, brain cells that are gone are gone.
Okay. The problem is, that if you start now, you've already had it from about 40, 30 years, okay? And now, okay, I'm on a new basis, okay? New thing. I'm not gonna make up those last 30 years. I've got a little, either on my way, is it gonna be better?
So the question is it too late?
Yeah.
Right? Is it too late? It's never too late to start living the lifestyle I talked about. Never too late. Okay? That's the goal, right? It's never too late to start living the lifestyle. No matter what age you're at, it's never too late to start living that lifestyle. But what can we do with the existing plaque that's there? That's the question, right?
Right.
That's what we do in research, right? In research, we have medications that are designed to remove plaque and things of that sort. This year there was an FDA-approved medication, I think in July, where the FDA approved a medication that is designed to remove plaque. It's an approved medication. It's a medication I have in my office because I worked on that. With that. Last year, there was another medication that was approved, designed to remove plaque. We worked on that also. None of these medications are slam dunk cures. What they do is they buy time by slowing down the memory loss. Make sense? By slowing down the memory loss, they're buying time. How much time are you buying? You're buying maybe 6, 7 months, but it really depends on how early you catch it. Because the earlier you catch the problem, the better results we get with the medication, because you're saving more brain cells. Make sense? Early detection is more important than which medication you're taking, because whatever you catch early, you get better results. That's what we're seeing. Does that make sense?
Some of these, though, the cure worse than the product.
Yeah, I mean, these medications aren't without side effects. No, there's nothing without side effects. Aspirin has side effects, right? So these medications that have been approved, the last two, last year, that medication is called Leqembi. This year is Kinsula, right? This year is from Eli Lilly. Last year is from Biogen, Eisai. These medications are antibodies, is what they are. They're given through the IV. It's an IV infusion, like once a month or so. And what it does, is that it's an IV infusion of antibodies. Antibodies your immune system makes to fight viruses, bacteria, infection. When you get sick, your body makes antibodies to fight the infection. So these are antibodies that is designed by a pharmaceutical company and is designed to find the plaque. So if you have the plaque, and we can confirm it on a brain scan, right? Like my patients who have in their blood, if we find it in their blood, they move forward in the clinical trial where they're getting a workup of their brain at no cost. Physical exams, neurological exams, brain scans like the PET scan we talked about, the patients get that at no cost, right? It's covered through, not through insurance, but it's covered in research where we can quantify the amount of plaque that's in there. And then if we quantify it, they want to take the antibodies, it's completely optional. It's voluntary, no one has to take it, right? But these antibodies, what they do is they're designed to find the plaque. If you have the plaque, the antibody goes up there and then tags it. It binds to the plaque. Once it binds to the plaque, it alerts your immune system to go up there to clear the plaque.
Really?
Yeah.
Do they have a test to do that? I mean, other than taking
Like the test to
the,
determine
yeah, to determine.
the plaque clearance?
Yeah.
Yes, we do follow-up PET scans of the brain. Because we can quantify how much plaque's in there, right? So we do a baseline to see how much plaque's in there. These patients go through these treatments, every month they're getting an IV antibody. And then in 6 months, we do another brain scan to see how much plaque is left. That's how you quantify your success, the results. You have to monitor for side effects. These medications have side effects, right? The side effects is potential microscopic bleeding, some swelling potentially. Sounds really scary with that, but the majority of patients don't have the side effects. The majority, like those who do have side effects, the majority don't even know that they have a side effect. There's no symptoms. So we have to do like MRIs to go looking for these side effects because most patients don't feel a thing. Most of these side effects are reversible by just simply stopping the medication. It goes away typically, is what we see. But it can be dangerous. It can be dangerous. These medications, where it becomes dangerous is for patients who are taking like prescription blood thinners. The stuff you take when you have atrial fibrillation, right? Eliquis and Xarelto. Because if you have a medication that can cause a little bit of bleeding and you're on a blood thinner, that can make things worse, right?
You die from that.
Yeah, you can absolutely die from that. So none of this is without side effects, but what I can say is that we are making progress, right? None of these medications are slam dunks, which is why I believe you gotta live the lifestyle, right? With or without medicine, you have to live the lifestyle. More important than these meds. Yes, we are investigating these meds. Yes, we're doing clinical trials, and yes, we are making progress, right? We are at Alzheimer's research where cancer was 20 years ago. Just the start.
How about stem cell?
Stem cell, that's in research too, right? There's a doctor at Hoag Hospital that is putting stem cells in people's brains, right? Opening up their brain, injecting stem cells. He's doing research, and these are folks with Alzheimer's. He's getting some preliminary good results. So there's all kinds of research going on now with Alzheimer's with that. Yes?
When the antibodies go attack the plaque, and does it get absorbed into the body, so it's no longer
Yes.
located in that spot anymore?
Yes.
But yeah, that's like scar tissue. It's like when you remove it, the area that was damaged doesn't get fixed. I mean, what's done is done, right? All you're doing is
That's right.
eliminating part of the problem.
That's right. That's why early detection is better, right? You want to find the scar when the scar is a little bit, rather than when there's a ton of plaque in there. Make sense? As a matter of fact, when there's a little bit of plaque, you have a lower level of side effects, lower risk compared to a head full of plaque. Part of that side effect risk factor depends on the amount of plaque that's in there. Yes?
This may be too technical a question, but if you have a large amount of plaque and you use the antibody that attacks it, versus a small amount. When you remove the plaque, what benefit is that to the Alzheimer?
When you remove the plaque, you slow down the rate of memory loss.
Okay, that's basically, it's the plaque that is causing the memory loss.
Because it interferes with the brain cells communicating.
Okay.
Remember that?
You said that.
Remember how the brain cells can't communicate because the plaque's there, right? When you remove the plaque, right, you remove that interference, but you've already lost brain cells, right? You have less brain cells. So this has to be early detection, guys, to get the best results with that. Yes?
But if you remove the plaque and you don't change the reason why you get the plaque,
Yes,
then
yes.
it's just gonna get more plaque.
If you remove the plaque, but you don't change your lifestyle, what's the point?
Yeah, right.
Maybe it takes a long time to build up.
It does take a long time to build up,
And we're
yes.
already old.
My question is, I don't know whether you
Keep
covered
eating
it
sugar.
or,
Yes.
can you increase the brain cells?
Can you increase the brain cells? You
Make
can
new
make,
ones.
can you make brain cells? The answer is actually yes. But you can't make it at the rate that you're losing in Alzheimer's. But we know that exercise allows neurogenesis. You can make brain cells through exercise. You're improving blood flow, oxygen circulation, right? The other thing is this, and this is why I believe removing the plaque is moving in the right direction, because we know we can slow down. And we all want to slow down that rate, right? You gotta weigh the risk versus the benefit and all that. But I know that when you live the lifestyle, especially in the early stages before it becomes late, you can build what's called cognitive reserves. What does that mean? What does cognitive reserves mean? So what we have seen in the world of Alzheimer's is that those who are more educated, highly educated, have a lower risk of Alzheimer's than those with a lower level of education. Okay? It's not because they're smarter. It's because they've spent more years building that cushion of cognitive reserves. Make sense? You spend more years. Now, I'm not saying you have to go back to school. I'm just saying you gotta do things to keep that brain building up your cognitive reserve. Because we know that there are people with plaque in their brain who do not have memory loss. You know why? Their cognitive reserve is all the way up here. Make sense? And it's the lifestyle that builds up these cognitive reserves. To build up that cushion. And it's frustrating for all the PhDs and MDs and doctors who come to see me, because we do these standardized memory tests, right? Where if your score's here and up here you're normal, you get a normal score. And if your score's here, it's not normal, right? You have an abnormal score. But there are some people who starts all the way up here, and they realize they're losing their memory, and they drop from here to here. But here is still above the normal range, right? So the doctor's like, your memory's normal, right? Your memory test is fine, get out of here. And they're like, but doctor, I noticed my brain has changed, I'm not the same. But because they're all the way up here, they had so much cushion, right? That they go here, but the standard memory test doesn't detect that. That's frustrating, isn't it? I see it all the time with smart people, right, that come in to see me, because their score's normal, but they know they've lost something up here. So I teach them about the lifestyle to keep it up there. Don't let it go down here. So important. Because there are people who have a lot of plaque in their brain, but their memory's perfect because their cognitive reserve is up here. Makes sense? What we can do is build our cognitive reserve. We can all do that with the lifestyle. Whether you got plaque or not, build that cognitive reserve so that you create cushion. As your memory's going down, you create that cushion before it's detectable. Yes?
Is reading like classical books?
Reading classical books? I guess it's better than Mad Magazine. Spy versus Spy. You guys remember that? In Mad Magazine? Me too.
Oh, yeah.
I still read Spy versus Spy. At Barnes and Noble.
Went out of business.
Right, so, I mean, reading's good, but there's better things than reading. It's learning a new language, doing something where you know you're learning something new every day. Yes.
Does it make a difference to your brain if you're listening to the words?
If you're listening, Audible book. I know, I'm an Audible fan now. I hardly read a book and when I'm listening to them, when I'm driving, when I'm flying. It's good because your brain is keeping your brain going. So that's not a bad thing as well with that. Yes, but the point here today, guys, is Alzheimer's is lifestyle. Alzheimer's is nutrition, it's diet, what you eat, what you don't eat, how much exercise you get, how much sleep you get, how much sugar you have, right? How you correct your hearing, your vision. Alzheimer's is lifestyle. And we're all in control of that as much as we can. Because there are other countries in the world where people live as old as Americans without Alzheimer's. Think about that. It's not an age thing. Yes?
You didn't say sleep on the 14th.
I did say sleep on the 14th. Yeah, it did not make it on the list, but give it another few years, it'll get on there. Sleep is very important. Sleep is very important, not just for Alzheimer's, but for everything else. Right? That's another hour lecture, 2-hour lecture I can give you guys at another time on the importance of sleep, right? But when you are sleeping, so when you're sleeping, it goes in certain stages of sleep. You guys ever learn about the sleep cycle?
Yeah.
Right? So this little ring here, right? This little ring here tells me how much sleep I got. Right? It's called, and it goes to my cell phone. And I open up an app, right? And it tells me how much sleep I got. But the sleep cycle, it's like noon already, right? We're done. But the sleep cycle, you go from like awake, light sleep, deep sleep, REM sleep, right? And you go back up to awake, light sleep, deep sleep, REM sleep. You guys familiar with that sleep cycle? Right? During deep sleep is when Alzheimer's plaque is being removed. So if we're not sleeping well, guess what's not being removed? Absolutely. That's why sleep is a risk factor. Make sense? It is 12 o'clock, guys. Didn't that go quite fast? Do you guys want my phone number?
Yes.
Okay, I'll give you my office number. I'm in Long Beach, right next to the community hospital by the circle, the traffic circle. It's 562 area code, 562 606 562 606 5999. 5999. You can just call and ask for a memory test. And you can say, I saw Dr. Trin at church, can I get a memory test? And we'll bring you in for a memory test and all that. And, we can chat in the office. I'll have more time with you if you want. But
Where's your office?
my office is in Long Beach. Yeah, in Long Beach. Yes.
I had a memory test once, and then the next year, they did the same one, and it's just a sheet of paper with a few, it just seemed like I wanted a different one.
We do a more complicated one than that.
Okay.
Yes.
Okay, couple questions. One, may we see the video since I'm late?
Oh, the video? Yeah, Pastor
Yeah.
Ron's got it.
Yeah, it'll be published in the 60 Plus newsletter or flash, probably this Friday, next Friday flash.
How do we spell your name?
Oh, how do you spell my name? Well, that's a memory question. Who am I? Trin, T-R-I-N-H, Dr. Trin. T-R-I-N-H.
Another question is, a doctor told me that fat causes diabetes because it blocks the entry of insulin to the body. Now, the difference between the fat from food versus fat from steak, is steak better fat than?
What? That's the worst fat.
From carbohydrate, because you can get fat from carbohydrate versus fat from steak.
Well, fat is fat when it ends up here. Fat is pretty much fat, but most of fat is probably from sugar. Yeah, most of it. Olive oil is good. As a matter of fact, we're out of time, but in my ebook, I have a list of foods that's good for the brain. Sounds good?
Great.
Okay.
Last question.
Well, is the physical diet basically ketogenic type of life?
Mediterranean diet.
Mediterranean?
Mediterranean diet, good for the
Sort of,
brain.
okay.
God bless, guys. See you next time.
Thank you so much.